Last November, nearly half the hospital beds in Louisiana were unoccupied. More than 4 of every 10 beds were empty. The evidence shows Louisiana already has enough hospitals. So many, there's even a shortage of patients. Yet someone keeps building more, in some cases, just down the street. For example, in Metairie, Doctors Hospital has been built next to East Jefferson Hospital, which is itself undergoing expansion. The Federation of American Hospitals reports that Louisiana by far leads most other states in private hospital construction. For instance, compare these figures showing 4 projects being built in Georgia, 3 in New York, and 1 in Illinois, but 17 hospitals under construction in Louisiana. Analysts blame the lack of state government control in Louisiana over new health care projects. Healthcare experts disagree over how all this construction affects your hospital bill. Many say more modern hospitals improves the quality of care. But is it worth it? Some say no, and you pay. Bob Notoriani heads the Metropolitan Hospital Council of New Orleans.
The more idle beds you have, it tends to increase the cost because you have to cover the cost of those beds even though they're not filled. There's a certain fixed cost associated with it.
On the other hand, some experts, like State Health Secretary Dr. Sandra Robinson, say you can't prove empty beds raise the price for hospital care.
I think it costs more, but we can't say it's from overbedding. That is one way of looking at a very complex system and trying to make it simple.
There's strong evidence, however, that too many hospital beds at least contribute to higher health care bills. A look at occupancy rates around the New Orleans metropolitan area over the last 3 years shows a steady decline in the proportion of used beds, from 68% in 1982 to last year's 57%. Hospital businessmen say rates statewide have followed the same trend. During the same period, prices for Louisiana hospital care went up dramatically, from less than $1,900 per admission in 1982 to almost $2,400 last year. That's an increase of 28%. The state health plan, the rule book used to determine the need for new hospitals and nursing homes, states it like this. Too many beds can mean higher costs and inefficient use of healthcare resources. Empty beds may inflate overall costs and encourage overutilization. Yet Governor Edwards and some of his business associates, including Ron Falgout and James Wiley, found ways to get around the state health plan when they obtained certificates of need for new hospital and nursing home projects. In exchange for money, they transferred those certificates and the government reimbursements they provided to big development chains, which kept on building hospitals and nursing homes for profit. Critics say the governor's business tactics also helped inflate the price for health care in Louisiana. Lawyer Jim Cobb represents some hospital operators whose own applications for certificates to expand their businesses were rejected by the state in favor of new projects proposed by Edwards' friends.
Getting a certificate through political influence or however, and turning around and selling it to somebody, you're providing nothing, you're doing nothing. All you're doing is adding additional cost. And if there's one thing that the healthcare consumers of this state don't need right now, is useless additional cost to their healthcare bills.
Here in Gonzales, one project for which Edwards helped get a certificate of need now threatens a public tax-supported hospital. East Ascension Parish Hospital has 50 beds. As of now, about half those beds are empty. But with Edwards' help, the American Medical International Corporation is building nearby a private hospital. The second hospital will provide 150 new beds critics say no one needs. Parish taxpayers therefore face 2 unpleasant possibilities. If the public hospital survives, its administrators predict higher prices for patients at both hospitals.
Somebody has to pick up the tab for these beds that are sitting here idle, waiting on patients to be admitted.
But if the public hospital has to go out of business, as some experts predict, East Ascension Parish taxpayers would lose a $9 million investment. And taxpayers have just approved a 20-year property tax for some improvements at the hospital.
And if they drive us out of business, they'll be paying for something they don't have.
I
I, Edwin W. Edwards,
do solemnly.
March 1984, Edwin Edwards is back in office. July 30th, with health officials expressing concern about too many hospital beds, Edwards orders a temporary moratorium on hospital and nursing home construction. But on the same day, Edwards also directs state health officials to bypass normal channels and approve 10 projects, 8 nursing homes and 2 hospitals. 7 of the 10 projects are planned by Wiley and Falgout, the same friends who earlier helped Edwards make $2 million. Records show various other friends of Edwards also stood to gain from the hospital and nursing home projects. U.S. Attorney John Volz says a federal grand jury in New Orleans is investigating possible bribery, extortion, racketeering, and fraud.
they told me I was a witness, a subject, and a target.
Tomorrow, we'll take a look at how his possible indictment could affect state government.